Nation of Fit and 10, welcome to day 53, and we've got 17 days to go. The last couple videos that I did was in response to a question about somebody who was frustrated with their lack of results. And so we dived into that a little bit, and assuming that everything is as is supposed to be, okay, let's just go on the premise that this person or anybody else who's in this situation, because this is not the first time this has happened, going along the premise that this person is following the caloric amounts, or more specifically the macronutrients, is getting in all their training, and in fact this person is doing extra training, and of course they're not seeing the results, and this goes on for a period of time. This person has seen results, but not to the degree that we want to see, of course. You may want to consider having certain blood tests done. So here are some blood tests that you may want to consider getting done. So number one, looking at your cortisol. Okay, so blood cortisol levels. Again, cortisol will go up when you basically, when the body is under stress, any kind of stress, cortisol is going to go up. And so having small periods of time where cortisol goes up is normal. That's fine. That's just part of the process. We need that to happen. It's part of being healthy. But having abnormally high cortisol levels over time, this is not good. I'll do a separate video on cortisol because I want to go through all these right now. But just think about staying away from stressful situations. This could be extreme dieting. This could be over-exercising. This could be lack of sleep. All right, so cortisol is one thing you want to get checked. Number two, C-reactive protein. Okay, this is a general marker for bodily inflammation. Number three, glucose. Get your fasting glucose checked. Number four, hemoglobin A1C with an estimated average glucose. This is sort of like a marker that gives an overall perspective of what your blood glucose has been doing over the last several months. All right, so this is a good one to have to see, are you pre-diabetic, are you diabetic, that type of thing. Are you having a hard time dealing with blood sugar levels? Number four, IGF-1, insulin growth factor 1. This is an indication of potentially whether you're producing enough growth hormone or not. Get your thyroxine check, get your T4 and your T3. So your thyroxine and your basically just your T3 and your T4. All right. So basically, one's the active thyroid, one's the inactive thyroid. These are both important. Also, you want to get your thyroid stimulating hormone checked as well, your TSH. I'm not sure which one I'm on because I did a bunch there. So I think I'm on 5, 6, 7. I think number 8 now would be leptin. Get your leptin levels checked. Leptin is a hormone that your fat cells release to basically tell you that you're full. And that would be basically all the basic ones that I would get checked. Are there more than this? Likely. I didn't make a list of that, but this would definitely give you a good place to start. Should you encounter anything where it's like, listen, I've been following something that's reasonable over an extended period of time. I've not been deviating, at least not deviating, many times. I've exhausted all avenues. We look at your sleep, we look at the amount of exercise you're doing, we look at your non-exercise activity as well, and of course your diet, and we go through all these things. And this is not an exhaustive list. There's probably a couple of things I would look at as well. Putting all of those things, everything looks okay there. This is where we go next, okay? So, all right, question. This is going back a couple days ago, and I didn't fully answer this question, so let's get to it here. 4.5 minutes, okay, not bad. How to maintain muscle mass when you're sick or injured. So when you're sick, that's it. You just rest, okay? You just rest. You get as much sleep as you can, and try to eat good food. Still try to eat good food if you can. If you can't, don't worry about it. But the name of the game here is rest. You want your body, basically all the faculties of the body to be able to do their job with minimal stress. Okay, we want the immune system to be able to just focus on trying to combat whatever whatever invader is in the body that's causing the sickness. If you're injured, okay, so this is a great question. I cannot tell you how many times I've been injured. Generally, this is not because I work out with weights. This is because I've been dumb. Okay, I've been stupid, doing stupid things, training too much, doing things that I knew better, doing things that I should have done. Anyways, I've had so many injuries. The great thing about, and we'll talk specifically here about resistance training, is if you're injured, okay, unless it's something catastrophic like a car accident, you get a broken spine or something. If you are injured, generally speaking, you can just work around it. But always been able to work around things, okay? Even like a really bad pulled lower back or whatever. There's still so much you can do. The worst thing I see people do is when they're injured, or even if they've had like a surgery, on one of their extremities, is just not working out for a while and just that's not what you want to do. You want to keep moving. You want to keep your body as physical as possible, throughout this time. So depending on the injury, you want to keep working out. Obviously, you don't want to stress or aggravate the specific injury. So you want to avoid that. So I'll give you an example. So last year I had a severe strain, possibly a partial tear in my rotator cuff on my left shoulder, and I could not move my arm, and I couldn't do like a lot of things for at least a number of weeks. Upper body wise, I couldn't do a lot of things, but I did what I could. So I could do all my legs. So I trained with legs. I could do certain tricep movements. I could do modified certain back movements, but I couldn't do any shoulder movements. I couldn't do any chest movements. I could do some abdominal work. I did some lower back work. So there was a lot that I could still do. I could still do probably 2/3 of my body, okay? But I couldn't move my arm. Like literally, I could not move my arm. Like when I say I couldn't move it, I mean, okay, I could move it. I could move it like an inch out, an inch in. It didn't matter. The day after when I had these symptoms, I was in the gym training. And that's not to say like, wow, kudos to me or, I'm somebody special. I'm saying this because there's still a lot that can be done. So, and this is important for you to continue to progress. So injuries should not stop you unless it's something really, really bad, okay? Like, I don't know, like a serious head injury or, God forbid, or a spinal injury or something like that, okay? There's really no excuse to not train when you're injured, okay? Obviously, depending on the injury. We just work around things. We work around things. Again, this is the best thing about weight training, is you can just, because you're focusing on different areas. So, okay, 8.5 minutes here. Message of the day. Message of the day: change the way you look at things, and the things you look at change. Essentially, just perspective, right? It's just perspective. So just remember that we have a choice on how to look at things. For me, I'll just give you an example since we're talking about injuries. I always look at injuries as, okay, let me figure out what I was doing wrong, because I was doing something wrong. All right, and then you learn from it, and then you train smarter, right? Or you discover that there's some areas perhaps you've been neglecting, as minute as they may be. All right, so there's maybe some prehabilitation that I wasn't doing, or you weren't doing, or whoever. So ultimately, we've got to, kind of find the silver lining sometimes with things that we just look at as just being outright negative, right? There's always a silver lining, or there usually is. All right, perspective, my friends, perspective. Positive energy, positive vibes. Believe in yourself for the love of God. Give some gratitude, and I'll talk to you all tomorrow.